Everybody likes being happy. Yet, at times, we suffer from physiological pain. So what exactly is pain? How do scientists define it at the molecular level? Can poisons and neurotoxins help us reduce bodily pain? Let's find out today, in this episode of Videonium Sci-Tech. According to the revised definition, formulated by the International Association for the Study of Pain, or IASP, pain is defined as an unpleasant sensory and emotional experience associated with tissue damage. Although IASP fails to identify pain that is not associated with tissue damage, it does acknowledge its presence. Speaking of physiological or bodily pain originating from tissue damage, scientists have been doing plenty of research for decades to subjugate or conquer it. For instance, when patients with cancer undergo chemotherapy, the induced neuropathic pain is seriously debilitating to nearly 4 out of every 10 patients. Opioids such as morphine are generally recommended to these patients to prevent them from pausing chemotherapy at an early stage. However, opioids like morphine are highly addictive and are therefore administered with utmost caution. Researchers have recently started considering an alternative to this highly addictive opioid drug. Known by the name tetrodotoxin, this deadly neurotoxin, which otherwise ends up killing people, can actually be used for controlling pain. The trick here is to use it in extremely tiny doses. Just sufficient to control pain, but not enough to hurt or kill the person to whom it is being administered. Tetrodotoxin occurs naturally in pufferfish. It targets sodium channels in the patient's peripheral nervous system. By blocking the sodium channels, tetrodotoxin limits the conduction of pain signals to the central nervous system, thus offering pain relief. The good news is that synthetic organic chemists have recently been able to identify reaction mechanisms that can massively increase the efficiency of tetrodotoxin synthesis in laboratories and manufacturing plants. The novel synthetic process involves 22 steps and gives an overall yield of 11%, which is quite impressive, considering the fact that the previous route involved anywhere between 25 and 67 odd steps, and still gave an overall yield of less than 1%. So let's cross our fingers and hope that tetrodotoxin becomes available as a prescription drug for effective pain management after it undergoes stringent clinical trials. Subscribe to Videonium for research that matters.